Hey, Ron.
Hi, Lucy. Hi, Pat.
Haven't talked to you for a long time.
I know. I see you more than my relatives.
That's kind of been the way the world has operated in the last year, hasn't it?
That's
Yeah.
for sure.
Very depressing.
Mm-hmm.
You know that COVID, where you can get the COVID tests, where you can get those free tests, they opened it up today.
I saw that. I already ordered them.
Yeah, so did I.
Steve and I had sort of a little bet on how fast it would take for the site to crash.
Well, that's what we were talking. Because we were at lunch with some people.
Yeah.
They thought it's going to probably crash right away, but I kind of know it's no problem.
Yeah. I hope it doesn't. I just know that there were probably a lot of people waiting for tomorrow, and
yeah. Got it out of the way today.
Good afternoon or good evening.
Hi, Bob.
How's everyone?
Good.
Doing well.
Good.
How are you?
I'm as good as I can be. I'm fine. No problem. Didn't seem like 40 degrees today, though, did it?
No.
No.
There was some melting though.
Yeah, a little bit.
Yeah.
I'm currently in a hotel in Redondo Beach, California. Been here for 2 weeks. So
really?
it's fantastic
Lucky
here.
duck.
The weather's fantastic.
Very good.
You can leave now.
I'm not here for fun. It's all work. So
Oh, well,
Yeah, you poor woman, yeah.
Well, I heard California. What part of California?
I'm in Redondo Beach.
Oh,
So
nice.
it's beautiful. I'm actually steps from the water.
Yeah, my brother moved to San Diego, loves it. He was in Northern California and decided he wanted Southern.
The landscape is unlike anything I've ever seen. It's just beautiful.
How long
I'm
will you
sure
be
there
there?
are worse places to be on business. So
Yeah,
good
I was
for
gonna
you.
say.
Right. I fly home on Friday. This is actually my 6th week with them.
Okay.
Not consecutively, but
Mhm.
I think this is going to be a normal thing for me.
Hmm.
There's Mr. Powers.
Hello there.
How are you?
I am good. How are you?
Surviving.
Good. Time to go up to the cabin?
Pardon?
Time to go up to the cabin?
No, we don't get up there in the winter.
Oh, okay.
Well, my husband referees a lot, although this year they've been losing a lot of games because of COVID. The schools at the last minute, well, we've got COVID, so they have to cancel.
Yeah.
Hmm.
There's an awful lot of that going on with
Yeah.
any sports teams. I think
Right.
they're just doing their best.
Wow. Huh.
I always say it's not a good sign when the professionals have a hard time keeping it out because they have all the bells and whistles.
I know.
Exactly.
The COVID, what is it, the hotels, and you're like, they can't do it, boy, the rest of us are
Yeah.
going to struggle given what we have to work with.
We probably put more effort into staying away than they do as well.
Could be, Bob.
I was down at the cornucopia food pantry today. I volunteer. Wasn't there getting food. And we put a maximum, we only let 5 people into the waiting area at a time.
And does that work out okay, Lucy?
Yeah.
Or does it?
No, it works
it
out.
hard?
But we have no problem because then what we do now is that they actually can go back and pick out their own food. We have shopping carts and a volunteer goes with them. And depending on the size of the family, depends on how many things they can pick out of each of the categories.
Mhm.
Yeah, that's a nice model that they moved to, like more of a grocery store.
Yeah, it really is.
Really.
Well, there's no waste that way. People aren't leaving stuff or throwing it away because they only take the things they want.
Sure. And any of us who've ever fed kids knows that there just are some things that might be real good for you, and
But
Lucy would like to put in my bag, but if
Well,
my
it's
kids won't eat
6:30, so let's begin.
Okay.
And we have a quorum.
them. Okay.
Have we any guests or public participants?
No guests today.
No guests. All right. Would someone make a motion to approve the agenda?
So moved.
Second.
Discussion? All in favor?
Aye.
Opposed? Motion carried. Need a motion to approve the minutes of last month's meeting.
So
I
moved.
move approval.
Was there a second?
Second.
Discussion? All in favor?
Aye.
Aye.
Opposed? Motion carried. Presentation, Katie? You-
Great, thank you. I just wanted to give you an overview of the 2020 annual report. And so the 2020 annual report is based on mostly we had our COVID-19 response going on. So as you know, that we continuously monitor for public health threats, and we were notified in January about this novel coronavirus, January of 2020, of a novel coronavirus. And by January 24th, we were setting up our incident command for the health department. And we, at that time, we only had prevention measures. So the 2020 annual report is really focused on the COVID-19 response in regards to the prevention measures, because we didn't have a vaccine yet at that time. We didn't have treatment methods at that time. So it was really focused on the prevention and the testing. By the end of 2020, we would have over 25,000 cases in Winnebago County residents and 383 deaths. So this report kind of focuses highly on COVID-19 response, the communications that we had. It also, though, does highlight a few times where we, had to, while we were doing and responding to the COVID-19 pandemic, we also had to continue to provide vital services to our residents. And we continued collaboration with partner agencies. So for example, for planning for the I-Plan. And we continued to try to slow the spread of COVID-19, improve the health of our entire community, and work to address issues that resulted in health disparities, which the COVID-19 pandemic definitely highlighted health disparities. So I'll just try to quickly go through just a little bit of highlights from the different sections. So remember that the annual report is organized into our domains. So the domains that we go through for our Board of Health and how our core elements of public health. So for monitoring health, we're constantly monitoring for potential concerns that could be of risk for our community. When we identify those concerns, we're responsible for communicating that out to the public and to healthcare providers. So for example, when we got the COVID-19 information, we issued health alerts to healthcare providers detailing potential symptoms, epidemiology factors, prevention, and how to reporting requirements for COVID-19 at that time. By March 15th was when we announced our first case, but prior to that, at March 12th was when we were really actually providing recommendations of limiting public events to 25 people, and that impacted events such as the Rockford St. Patrick's Day Parade. We were continuously giving out updates, as you can see some of the daily reports on the side here. So we constantly monitored that. In addition, we also had to monitor for other public health diseases of concern, foodborne illness, influenza, STIs, sexually transmitted infections, those types of things. So then we get into diagnosis and investigate. So case definition was identified for COVID-19, testing became available, and the WCHD worked with the University of Illinois Health Sciences campus in Rockford to stand up a testing site in Winnebago County, and that site was eventually transferred to the Illinois National Guard. We worked with residents to identify the cases and then isolate and quarantine individuals that were identified as cases or their close contacts. And as spreading expanded, we needed additional staff to support those communicable disease and contact tracing investigations as well. And we had close partnerships with our schools, our businesses, and long-term care facilities to support contact tracing, and they used systems called RedCap and others to closely monitor potential cases of COVID. During the response, information sharing was important, especially with the community. There was continuously updated information as it was a new pandemic. So with that, digital media, such as social media, became really important to be able to quickly provide updated information to the community. But at the beginning of the response too, we just had a lot of updated information to share. So impressively, we had 50 news conferences that were held from the time we gave the first news conference in March through, there were two a week that Dr. Maternal was able to hold through June, and then weekly news conferences through the rest of the year for approximately 50 news conferences in 2020. So thank you, Dr. Maternal, for conducting all of those news conferences too.
Thank you for organizing all of those.
And then the community engagement. So as you know, there's a lot of complex social and environmental factors that contribute to health inequalities. And so to address those, we had our communities of concern group come together that was launched in April 27th. And they worked on addressing the complexities and hesitance and specific messaging needed for each community. So these were communities that were most impacted based on zip code by COVID-19. They launched messaging campaigns on masking to encourage masking in those zip codes. And they worked with the community members who may be influencers to push out messages through social media. They worked on getting handouts that provided COVID information and access to resources and getting those out door to door in neighborhoods in those zip codes as well. In addition, we had other partnerships that continued that are regular important community engagement ones that we work with. So our Community Health Collaborative, which works on the I-Plan, and the Opioid Response Team, which works to address the opioids, and the opioid response team announced the opioid standards of care and continued to work on naloxone training and distribution during that time. And so our one of the main focuses that we had to do is continuously provide policy updates. So basically guidance. So we activated our emergency response plan in response to COVID-19, and the groups that were working on policy continuously had to provide guidance. And so they worked in collaboration with our community work groups to provide guidance around schools, daycares, holiday guidance, travel, business, places of worship, just a lot of updating guidance, and continuously needed to update that guidance during the response to provide the most updated prevention recommendations with providing access as well. And then for the public health, so the laws and ordinances can help protect the public's health. And so WCHD, when we were, kind of issued with maintaining the requirements for someone, sorry. So we basically, there were orders that were put in place. So the executive orders that may have put in place, we had stay-at-home orders that were put in place. We had orders for masking mandates. Those were at a state level, right? And so the local health departments, we were trying to implement public health requirements that were required. And so for our food establishments, for example, we put up the guidance for how we would provide these enforcements, detailing the enforcements of how that would be done. And we followed up on complaints that were received from the community. If a complaint was received, we'd escalate it. And then throughout that process, we had actions on over 100 establishments in 2020. And those ranged from everything from providing a non-compliance order of non-compliance, which they might have then come into compliance, all the way up to suspending food permits, which in 2020, we ended up with 15 establishments with suspended food permits. So it kind of highlights public health laws and ordinances. We were also ready and prepared to enforce isolation and quarantine orders as needed to ensure the health of the community as well. But overall, we're trying to kind of support businesses, encouraging people to go to places and utilize the curbside and pick up and things that they could do in a safe manner. So that was important too. So one of the highlights of the COVID response was trying to maintain linkage to care. So we see this even right now, but in 2020, with that first case that was coming, we were trying to make sure we were maintaining access to critical care for the community. And as the number of cases were surging, it remained a priority to make sure that there was capacity in our hospitals. So we worked with the Illinois Emergency Management agencies to make requests for beds and ventilators and staff to help support the surge of capacity at our local hospitals. The 3 local hospital systems came together as one system to address COVID-19, and they worked with the Winnebago County Health Department and the Winnebago County Emergency Operations Center to prepare for an alternative care site to provide additional critical care beds. We also focused on making sure that we could address shortages for personal protective equipment for hospitals and long-term care facilities. And we worked with the EOC for that. and we coordinated care for the testing sites. So remember, we were able to get we have 2 community-based testing sites in Winnebago County now, but we were able to make sure we have testing available for residents as well. So and for all this response, we really needed to surge our staffing. So we started off 2020 with an average of 90 staff, and that surged to 115, an average of 115 staff. We also need to have support from other areas as well. So we had the Medical Reserve Corps that was able to help us support case investigations and contact tracing and community outreach. We also had our staff from other areas that we brought into the incident command through the incident command structure, reassigned from their regular routine duties to help with the response. So that helped us surge our staffing. And in addition to surging staffing, our staff had to adapt. So remember, we were continuing to provide for regular services and vital public health services as well. And so our staff had to learn to adapt their programs to provide those services. So for example, our environmental health improvement provided in-house hearings using Zoom. Our WIC program provided vouchers for supplemental nutrition food through mail and curbside pickup. And then eventually the state electronic benefits transfer cards were enacted in 2020 for us. And so our WIC program was able to utilize those, which help enhance the remote service for clients. So that was great news from 2020. And other services, again, you know, we had programs that do have to do home visits, and they were able to adapt to do virtual visits or porch visits as needed. And when needed, we're able to utilize safety protocols to do at-home visits when necessary. And while we were maintaining, a response, we did have key elements of our quality improvement initiatives that actually were pivotal for the COVID-19 response. So in that, the environmental health improvement, they actually were working on making food establishment inspection results readily available on the WCHD website. That project actually was able to launch in 2020 and provided transparency for inspection results, which was really crucial when we were following up on complaints for establishments that were failing with failure to follow the executive order. It provided that transparency of which restaurants we were following up on, what the results were of those inspections and that types of thing. So that proved very vital for transparency during during the pandemic. The other project that proved vital was the health protection project to modernize reporting systems for communicable diseases with laboratories and infection control. So it was really important to engage with the laboratories and infection control during the pandemic for a quick turnaround to prevent the spread of COVID-19. They were able to use REDCap and for sharing reporting and data at the time. And so for evidence-based practices in this response, because information was changing so quickly, we were using evidence-based practices that was being provided, by the CDC, IDPH, other groups that were helping us understand this virus and this disease. And so, for example, when we started the pandemic, it wasn't known that masks could prevent the spread, but through epidemiological data, they found that masks were shown to reduce the spread of COVID-19, especially when everyone was wearing a mask and all parties were wearing a mask. So then we started, providing masks became a key point in preventing the spread of COVID-19. So in our management, we just talk about, that we worked, that we launched our incident command on January 24th, 2020. So yes, we are coming up to the 2-year mark next Monday, of being an incident command. And we worked with the EOC. And another just highlight from here that we haven't talked about yet was that we actively participated in policy committees that were convened to work with healthcare partners and elected officials to address the pandemic. So that's something I haven't talked about yet. And then governance. So our Board of Health, so you guys had to adapt to working with you. You guys adapted to working on Zoom, having Zoom meetings that were live streamed to YouTube. You had patience while we figured out the technology with that as well. And we had to figure out a way to work with you to get emergency consensus to things that we had to get through quickly between board meetings for responding to the response. And you worked with us to be able to figure out those time sensitive response matters and ratify them in the next Board of Health meeting. So thank you for all your flexibility and your support over the years. And finally, we worked with the mayor of the city of Rockford, we were county chairman, and the chairman issued 2 proclamations in 2020. Just in 2020, 2 proclamations were issued for the disaster, claiming that Winnebago County is a disaster area. And again, that allows us to activate aid and assistance for the emergency operations response. So that's really our domains. And then it gets into the data section. And so with the data sections, we provide each center with kind of a little data overview and then kind of a total budget. And then give a full data report down here. You can find all the numbers. We kind of got your images all off of Zoom. But just wanted to highlight a few things here. One, I think it's important to look at this number right here. This is the disease investigation number, 30,000, over 30,000. 2019, it was 5,000. So that just shows how much this pandemic with its 25,000 really added on to the work for contact tracing. Also wanted to just highlight gonorrhea. That went up from about 800 to about 1,100. So that was something, is watching those STIs. We saw impacts throughout our different programs, through mostly our health promotion and wellness and personal health services. Just seeing mostly an impact there from COVID, just not having people be able to come in, or different aspects to why those were kind of impacted a little bit by the response. And our EH, pretty much the numbers stayed pretty consistent here in our EH section. And then our budget. So that's the report. Are there any questions?
Thank you, Catherine.
Thank you.
No questions?
This is really, it's so easy to read, and it's so easy to see. And I just want to say, Katie and whoever else worked on this with you, good job.
I would agree, yes.
Yeah.
Nice job.
That's the whole team. Thank you.
So Peter, are you available to talk
Yes, sir,
about?
I am. Thank
give
you
us a
very
closing-
much. Good evening, everybody.
Evening.
I'm gonna share my screen now. You know if it's come through.
There you go.
Now it is.
All right. So using the same format we used last month, which is to get what was a many-page report down to 1 page. I know it's a little bit busy to look at, but we'll just kind of take a walk through the highlights on here. So if we look at what's been going, we're in a surge right now, as everyone's aware. So our case rate is over 1,800 per 100,000. And so you see that steep slope of that increase. So by CDC standards, anything over 100 cases per 100,000 puts you in the high transmission rate. Sadly, we're at 18 times that rate right now, or around there. Testing volume has continued to increase. We're up another 10% over last month. The ICU capacity, as reflected by this chart down here at the bottom of the table, really shows how the hospitals in the region are impacted. ICU capacity was down to about 5%. It's around 7% now. 20% is the threshold where IDPH has indicated you want to be above that level. So you can see that the region was okay until the surges that came through latter part of last year, and certainly now this year. The average, when we look at the deaths from COVID, those numbers have increased quite a bit in this latest surge. And this chart over here was what we looked at the number of deaths within these time periods. So in that first year, remember, vaccines didn't come online until late in 2020. And we looked at the average age of those who passed away from COVID, and it was at 78.2. If you look at this most recent period, we've seen 132 deaths just in these 3 months, but the average age of those deaths is 68. That has dropped significantly, and it's reflecting sort of the difference in vaccination rates and how serious it is, but how it's broadened out into the community. When we look at the impact on different communities, again, this is a familiar chart to you where we look at the age-adjusted rate. And for the Hispanic Latino population, it's still more than 2.5 times the rate of the white non-Latino population. A couple other things just to highlight is that as the state has shifted how contact tracing will be operated through the state surge center, and the local health department's focus will really be on congregate long-term care outbreaks in school settings. That's caused some repositioning and redefining of roles and responsibilities. And as we mentioned last month, that the health department stood up a on-site clinic to deliver monoclonal antibody treatment here at the health department. And we have just finished that, and I believe we ended at 237 or 238 treatments that were rendered. And so that's the overview of the COVID data status right now. Any questions?
Peter, is there any evidence that our community has peaked or about to peak in the number of cases?
Oh, I wish it were so, if only. The numbers these last few weeks have been very high. If you look at some of the graphs, at least for the state, things start to look like Illinois maybe plateauing, but there have been other times where we've had a few days with better numbers and we start to feel like we've turned the corner. So I would hesitate to say that at this point, but I believe that the projections are that this surge, hopefully within the next few weeks, will taper off.
I see. Thank you, Peter. Does anyone have any questions?
Thank you very much.
Okay, thank you again.
Just one quick comment, and that is I really like the summary sheet. I think it really puts a lot of information together very well. So thank you, Peter.
Thank you.
President's report, the confirmation of election of officers and committee members. I'm not sure what I'm to do on that one. I thought last month we had approved the election of officers. Is that true? Or?
Yeah, I think we did.
Is this just to confirm the committee membership then and make sure we're all on the same page?
I think so.
That's what I think. Yeah.
Yeah, you had asked for it at the last meeting, so we put it all together with everyone's either new, existent committee assignment, and then the chairs.
Okay.
I move we approve the committee assignments and chair and vice chair assignments.
Second.
Second.
Any discussion? All in favor?
Aye.
Aye.
Opposed? Thank you. We now need to go into executive session to discuss, to be part of a discussion regarding the
Gotta go
public
in the closed session.
health hearing of Mercy Health, Rockland Avenue.
Okay.
Would someone make a motion?
So moved.
Second.
I have
All
a
in favor?
question. I have a question first, a procedural question. Executive session is only for certain reasons, and personnel is one of them that we've always used. Lawsuits, another one that we've always used. LAFA, does this come under another exception?
Not that I'm aware of. I'm not even sure what's being discussed.
That's why I'm questioning whether it should be executive session or an open session.
It's not a lawsuit. So again, the documents are attached.
Okay, so why do we need executive session?
Right, I don't think that's correct.
I don't think you do, Ron.
Okay,
And I don't think anyone was requested. So maybe that,
Okay, so we'll drop that.
Well, do we need to vote on it and vote it down? Vote down the motion to go into executive session?
or withdraw the
I don't
motion.
think we-
I withdraw my motion.
I like to say I'm gonna abstain from this conversation.
So just to be clear,
Do
we're
we
in
need
open
motion?
session. Correct.
Correct, Catherine.
Do we
Thank you.
need a motion to back out of executive session?
No,
we never got into it.
We're not in.
All right. Okay,
just need to discuss.
all
So
right, then we'll turn it over to Sandra.
So there was a request made, as you've probably been reading in the papers. There is a public hearing being convened on the status of the closure of certain services in the Mercy Avenue, Rockton Avenue campus. And again, one of the areas was that the Mayor has been reaching out to individuals. And again, this was something the Board of Health had considered in the past and put a letter together and attended various committee, kind of the open public hearings. And so this is the background information that was provided. Again, with the idea being that you could take a look at it ahead of that, as well as the letter that was put together in 2015 that was put together by the Board of Health at that time and signed by President Powers regarding the Mercy Rockford Health System. At that time, it was the two campus, one hospital concept, as well as what you saw on page 31 of 98 were questions that when you had your presentation in 2015 from representatives from Mercy Health, we had gone through and we compiled a series of questions that you asked and then the responses to those questions. So that's giving you background information for consideration of what, if any, you want to provide in terms of either written testimony, in terms of a letter of support or non-support for this project to the Health Facilities Review Board. But again, this is something the board considered in the past. So what we provided was the documents that were all part of our information that we had at that time.
I want to say thanks for pulling those documents together, because I certainly remember every step of this. And I am concerned. Sandra, what happens for you? You are a part of the Health Facilities Planning Board.
I have already submitted I have to recuse myself. I've indicated that, as first of all, that it would be considered by my Board of Health and I'd be in that discussion. So I would recuse myself. I've already submitted that to the Health Facilities Review Board.
I do feel like we should say something on this. I do feel as though deserting the west side is a big issue.
I agree.
I have to go along with that, living on the west side. I mean, you know, there's a lot going on over into my district and the surrounding districts. And by the time, you know, they're shoving all this responsibility onto like Swedish American and St. Anthony. And they've already made the statement that they will not be honoring some Medicare insurance, and they aren't taking any of Medicaid people. And that, when you're in an area where your income is average and below average, that's a hard one to go to, and this is the only hospital available. I've talked on this before in front of the that commission. They don't listen. Do they really want to listen? I don't know. But I think it takes all of us to make a stand and show them that we sure are concerned, whether they listen to us or not. We need to go on record as supporting them not doing what they're doing. It's a shame, because right now their emergency room only has, I think, a nurse practitioner with a doctor that they can call if there's something they need to do.
Yeah.
That's not how you do an emergency.
That's not an
especially when you-
emergency.
That's not an emergency.
That's an immediate care center.
Area, we've had a lot of gunshots. We've had a lot of emergencies, and it's disgraceful. It really is to have them do this to us. So, you know, I'm asking all of you to please join in and make a statement as a whole. I will be making my own statement, but we still, as the Winnebago County Health Department, need to do that. My last time I talked to them, my closing remark was, and I'm going to use it again, Mercy needs to change their name because they show no mercy to the people most in need. And I have a problem with seeing them. I just do. I don't know. It's a lot of responsibility they're dumping on, especially Swedish American. I don't know how much St. Anthony's has taken of all this, but I know Swedish American's taken the blunt of it.
Probably just by location, it would.
I think we owe it to the people in the county too. It isn't just Rockford per se. It's the whole.
You have that right.
western- Yeah, it's the whole western part of Winnebago County.
Because Rockford, actually, the majority of Rockford is from Rock River going east. Winnebago County starts at Rock River going west, and we cover north, west, south.
Mhm.
Not only that, we're the biggest hospital for Stevenson County, Ogle County, Lee County, and we get a lot of people here from the state line, from Beloit and up in the state line. We really need to take that into consideration, the amount of people that this is going to affect, and especially in a type of trauma, when someone's having a heart attack and needs to get to a hospital right now, and they live on the state line, especially if it's a state line that is northwest. This is always for them to go. We also, at one time, when they bought the hospital, they had 2,400 employees there, and there's just a skeleton crew over there now. So it's just, it's very unfair on what they have done.
I think
So I'll
we-
leave that up to
Yeah.
the rest of the board. If they'd like to
I
do.
think we need to talk about what services we're most concerned about losing and prioritize some things. We gotta say something, guys.
Yep.
And think about what things, I'm not sure if it benefits us to just go kicking and screaming on everything. I don't know. But my thought would be, that we think about what services we're the most concerned about and focus our response on that.
Well, two of the services they have taken out of there is the mental health, which was very much needed, and the other thing is closing that emergency room the way they have done it. There should be doctors on staff, and doing it at this time when even other hospitals in Winnebago and the other surrounding counties need beds. They're closing 70 beds. And it doesn't make sense. They're probably short of doctors and nurses just like everyone else is. But they aren't giving the best service over there either, from what I understand from people who have been there. So I'm with you, Pat. We have to break it down into what are the most important parts.
So where do we go from here?
Pardon?
So if
So
I'm
where do we go from
hearing,
here?
I guess one of the things that I could draft some kind of a response based on, I think that we know that our most vulnerable communities with the high, what we call social vulnerability index, are on the west side. And we're concerned that any displacement of either preventative care or immediate care, I'm not sure hospital beds are always the key here. I think that just so you know, if you were to look at most of our planning areas, we have an overabundance of hospital beds, except for today when we have a shortage of ICU beds. So let that be that's an outlier. But, one of the areas that we were very concerned about was the maternal and child health. If you look back at our records at that time, when the board went on record to say we have concerns about that, we continue to have high infant mortality among those communities where our social vulnerability index is high. I guess the question is, I'm happy to draft a letter for everyone to consider, kind of in a more general concern about closure or any reduction in service, because you supported an increase in service at the time. That was your position. Anything that increased service to the community, you could support. So again, this looks like, I think if we want to just put kind of a summary statement together, but also if that's something you want to support as a board, if you want to motion that so that I know kind of the direction that you want me to go in to draft it, and then I could have, the executive committee review it on your behalf. And then
Thanks.
also as private residents or citizens, you also have the opportunity to register and submit testimony yourselves. You can speak on these, and it's by Zoom now. Everybody, so you don't have to travel to Springfield or to any other place, so that you can provide, as a member of the community, you 2 minutes to speak your piece, as they say. And we can also, if you want to be more of the formal process, we could have a member of the Board of Health speak on behalf of the Board of Health during the actual presentation of that information. So you've got kind of three options. One is a general letter of position. Two, then is if you want to provide formal testimony at the hearing as a Board of Health. And three, you certainly have the option, which you don't need to review with anyone but yourself, is whether or not you want to do it as an individual.
Pat, would you want to put a motion together based on what we think the important issues are?
I would like us to, I'm thinking about a motion. And y'all can amend this. I'm not wedded to this, but I would move that we do put together a statement from the board, not just, and I we can present it as a letter, but I also think we should have our president or some representative from the board speak in this hearing and be emphatic about our concerns.
I agree.
Can you condense that somewhat?
That was
There
a
were two-
motion. We need a second. That
Second.
Any discussion?
The only thing I'll say is I will be doing my own talking because of the fact it is my district that it's in. And so representing my district, I've talked this over with the alderman too. And so
Sure.
to be speaking.
Sandra, excuse me, Dr. Martell, do you have the direction that you need from the board to put
I
together?
do. I have the direction I need, and then I would certainly work. I will send it to Mr., to Bob McCreath, and he can, his executive board of executive committee there can take a look at it. And then if you want to have an appointed if anyone wants to, you can certainly edit it from there, but our time is of the essence too. I wanted to make sure that it was discussed in open meeting, that you had an opportunity to receive it. The hearing is the 24th of January.
26.
26, I'm sorry.
26.
Yeah, and so I want to get that, I would want to get this out in the next 24 hours out to you.
Okay.
Does that make sense? Lafa, do you have any concerns about that?
I do not.
I think I have enough to draft it based on your previous, build on your previous letter that was submitted. And your concerns about reduction in our vulnerable communities.
Okay.
Any further discussion? We have a motion and seconded. All in favor?
Aye.
Aye.
I,
Opposed?
And Dr. Williams is noted as abstaining.
Yes. Okay.
I want to thank all of you for participating in this. You don't know how much it means to have the Board of Health also make comment on what's happening with the Rockford campus. Thank you.
Okay, let's move on to the Finance Committee. Ellen?
Thank you. In your packet on page 44, we just need approval of the minutes.
So moved.
Second.
Second.
Excellent. All in favor, say aye.
Aye.
Thank you. Jim, are you on for the financial statements?
Absolutely. I'll share my screen now. Can everybody see the resolution here? No?
Yes.
Yes, okay. All right, this is one that we do vote on, and it's for expenditures incurred in the health fund in the amount of $1,297,860.22. Resolution by the Board of Health, be it resolved that expenditures for the Department of Public Health be paid for the month of December 2021 as indicated above.
So moved.
second,
And just as discussion, they are quite high for December because we have 26 payrolls in a year, and for 10 months or for 3 months we have, or for 2 months we actually have 3 payrolls, and December happens to be one of them. And then also we had a large expenditure for Qualtrics, which was grant funded for $195,000. So that's why we have a sizable number there this month.
Yeah.
So are there any other discussions or questions? Okay. Do you approve and we vote.
There's a
So do we
motion
have
and a
a
second. Just need a
motion to
vote.
approve the expenditures, right?
Yes.
We need to vote.
All
just
in
need to vote.
favor?
Aye.
Aye.
Opposed? Okay, all right, motion carries. The next will be, item B is the fund balance here. And we start out the year with a $10,023,790.82 fund balance. We've had year-to-date revenues of 2.8 million, 7,674.05, and then year-to-date disbursements of 2,858,812.63. So we have an ending balance of 9,972,652.24. So actually a decrease for the year of 51,138.58. So. And this is our financial review for the Board of Health, because we're now in the end of the third month or the first quarter for the county fiscal year, and actually half of the year for the state of Illinois in fiscal 2022. So we had budgeted revenues of 2.7 million, 19,920.75, and actual of 2,807,674.05. And for expenses, we had budgeted 2,694,862, and actual and encumbered expenses of 2,858,812.63. So a variance of 163,951. So we're actually over budget on both at this point, but that's because of the Qualtrics expense that was both revenue and reimbursement. So so that's kind of why we're over budget on both these items right now. And here is the balance sheet, and we have our cash accounts and equity and pooled cash, and then the other four, which bank reconciliations are attached as part of the packet. And then our liabilities for accounts payable, other payables, accrued wages payable, and our deferred property tax revenue, which we'll earn throughout the year, and other deferred revenue, which I have detailed out. So, and then the fund balance that we just went through. So is there any questions on the balance sheet? I'll move on. These are the detailed expenses as of the end of the month for December 31st, 2021 by object. So okay, so, and they total again, year to date, 2,807,674.05, and then 2,858,812.63 for expenses. So year to date, we have a deficit of 51,138.58. But again, we did have 3 payrolls for December, and I'm anticipating with an additional grant that we will be drawing on beginning in January for COVID-19 response. Our allocation through IDPH is about 625,000. So we'll use probably, close to $500,000 of that this year. And yes, there will be additional expenses that we'll incur, but also we'll be able to absorb some of the expenses that we would be incurring. So I'm anticipating a turnaround here. Now, this is the emergency reserve minimum graph, and then you'll see the red line there is our minimum reserve required, and then the green was the cash we had on hand this time last year, and then the blue is what we have on hand at this point. So still well above the minimum, but not where we were last year. And I'll go over that in a minute. Because here we have our detailed accounts receivable, which you'll notice down here in the right-hand corner, we have $786,000 due from the COVID-19 contact tracing grant. And I was just notified today by our contract manager at IDPH that many health departments have not received their COVID contact tracing funds. The Illinois Comptroller's Office has not made it a priority to expedite those, but they're anticipating we're going to get those this month because I've been waiting for a sizable reimbursement from them. And that's pretty much why we're not at the cash level I'd like for us to be. And so
I have a question. So are we expecting a portion of this 786, 228, or are we expecting the full payment?
We're expecting a portion of it, about 425,000 from the last quarter. These items here in red for these last 3 months, I'll be filing that in the next week or so with an exact amount, pretty close to that, but yes. So I've been, it's been quite a while. They were expediting those. I'd get them about a week or two later after I filed a reimbursement. So, but I'm glad that I got notice of it today because they know it's out there and they know we're doing it. So okay, I guess there's no more questions. I can stop sharing on the finance.
I like you showing this on the screen. I think it's a big improvement.
Oh, okay. Great. So, and then we went over in Finance Committee, the bank reconciliations from page 46 through 55. So if anybody has any questions on those.
If no questions, turn your attention to page 58, where we had the major expenditure requests. These are all approved and a motion to advance items A through D to the board as a whole.
Motion to approve.
Second.
Any discussion? All in favor, say aye.
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 Any opposed? Excellent. Proposed contracts and agreements on page 78. Cherry Valley Police Department Drug Overdose Prevention Program. Page 78 and 79.
Okay.
We'll need a motion to approve this.
Yes, you do.
I said, oh, no, we do. That's what I meant. I'm sorry. We need a motion to approve. I apologize.
So moved.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Excellent. Policies. This is a policy that has gone through finance, policy, personnel, and approved to a motion to advance classification and compensation policy. Since it's already approved a motion, all we need is a second, correct?
You don't need anything.
Oh, we don't need anything? Okay, good. The policy is on page 80.
Why wouldn't we need a motion in a second?
We don't.
Because it's being brought by all the committees.
Yeah.
Right, but when it says approved a motion to advance, isn't that already making a motion from the committee and you just need a second?
Yes.
Right.
And we should not need a second.
Oh, we should
because-
not? Okay.
Oh. I mean, that was just in the handout, what, a couple meetings ago?
Uh-huh.
But then we just, okay, maybe I missed. I thought we just did it for the finance committee.
We did.
We did, and we shouldn't have. And
Right.
it confused me too.
It
That's
did.
right.
I just let you carry on, Ellen.
Oh, thank you. Just that bus just hit a little hard.
Okay. We like to make sure we over motion it, rather than under motion.
So we motioned from every committee.
Yeah, so that's a second, it's a motion and a second all in itself.
Excellent. Any discussion? Do you want to elaborate on it, Sandra?
We'll just go. We started taking a look at this in policy, and it's a revised classification and compensation policy. We took a look at. It really started with some concerns and questions regarding we have various committees or policies that were involved with HR in our prior that had not been really looked at in 10 years. In addition, we had what I would call after 2 years, we have a problem with retaining. We don't have a problem recruiting and hiring because our salaries are competitive at the start, but we were falling behind in really retention of individuals. And so once they were here for a couple of years, they became then more valuable in the market. And so we began HR worked on this with us to take a look and say, were we competitive at starting salaries? Were we competitive at our salary ranges? And it determined that we were not. And so we really started to take a look at our compensation package. In addition, we were also kind of coming up against the minimum wage requirement on an annual basis required by law. So at that point, we pulled together all of these policies related to that to propose a new compensation package that takes a look at valuing our employees based on experience, kind of what we'll call front loading their I'm going to say their salary increases. And if you were to take a look at, for instance, you had to work 2.5 years here before you got a raise outside of a COLA. And so that really becomes difficult when you can go out and get a raise immediately in a new hire. And our costs, if you saw the cost comparison, what it costs in terms of turnover rate, Charlotte, and I looked at what was being put out there by when you lose an employee, what does it cost you? And so we started to take a look at what could we do to retain employees and really kind of respect and reflect what your policies were, which is you had a midpoint and a maximum. And really, when you start talking about governmental systems, 10 years is full investment. So at that point, we started to look at what were others doing out there. What did some of our collective bargaining agreements look like as well within the county, to determine how we could best value employees and to retain them in those early years and reward them for their ongoing service. We also wanted to make sure that it was sustainable. So you saw an analysis done of how many years would it take? What would it look like? And so one of the challenges we have is we may have to use some of our public health emergency reserve, but we are well above that line. And the first years are the hardest years. But when you start talking about year 4, we're really talking about the cost of a single position. By the time we really kind of put this into place and what we call true up the positions as we currently have them. And we also went through and identified some gender concerns that we saw and some gender inequities that had kind of been part of an old compensation, really when people came in at higher or how people had been given advancements throughout. And so we really wanted to make sure that we were kind of ensuring that we had all of those places really kind of addressing all those issues and concerns. So we started with the policy committee. We had finance look at it about our terms on sustainability and where the funding might come from. Jim also kind of went through this, just so you know that some of our grants will also be providing what they are calling a sustainability bump. Really with the idea being that they are recognizing some of the work over the pandemic to keep the public health workforce intact. So they are putting that in there so that we can recoup some of these costs as we move forward. But this should leave the organization in a better position as we over the next several years to ensure that we're keeping and retaining our valued and seasoned employees that are coming in that are are not entry level. In addition, that we are respecting the state law as it relates to making sure that we are in compliance with the minimum wage. So we also have to build in those kind of, so we don't end up with salary compression as the minimum wage goes up in our entry level grade. So that's why we took it to all three committees and went through in detail. And the idea being that we need to kind of modernize as well as propose something that would be looked at on an annual basis to ensure that we're keeping pace with the market and that we're ensuring that we have a competent and that our workforce is both recruited and retained and compensated at an equitable level.
Thank you for that excellent explanation. And thank all the committees for working on it, because retaining workers during this environment has been rough on every industry, and especially those associated with healthcare, with all the work that we're asking people to do, especially during this pandemic. It's good to make sure that we're giving them an equitable salary. So we have a motion. We have a motion on the board. We all in favor?
Aye.
Any opposed? Excellent. I believe that is all for finance.
Okay. Thank you, Ellen. Policy committee, Ron?
I just need approval of our minutes from the January 12th meeting.
So moved.
Approval.
Second.
All right. Any corrections or comments or questions? All right. All those in favor?
Aye.
Aye.
Opposed? That's it for policy.
Lucy, personnel?
Okay, for personnel, I need a motion to approve the minutes of the January 12th meeting that we had at 3:30.
So moved.
A second?
Second.
All in favor?
Aye.
Okay. And then nothing on the classification that's been handled. And then we need a motion to approve the executive agreement for the public health administrator, which is, it goes into effect actually on December 1st, 2021 for a period of 3 years.
Make a motion, we approve that.
There a second?
Second.
Are we going to
Okay.
see it?
Well, we've already seen it. I mean, you've already looked at it, already had it.
With the terms?
I think for that, would we, Rafa, would we need to go into executive session to be talking about the terms of it?
Not at this stage, I don't.
Right, it's already been discussed.
Right,
To vote on it, you can't be in executive session.
Right.
right, but I didn't know if you're gonna talk any further, we'd probably have to go into executive session, wouldn't we? If you're discussing the terms in it?
Is it a secret?
Right. Because it's about to be voted on. So what we would be discussing in closed session. I don't
I don't know, I mean, if they have questions on what's in it,
Well, how do
Is
we
your
vote on
question-
something we don't know what it is?
I
well,
thought
the
we
only
got,
changes from the original one that everybody did see was a change in compensation to make it a flat amount of 170,000, with the understanding that Dr. Martell is going to waive any COLA adjustment for 2022.
And it's a 3-year term?
It's a 3-year contract, yes. The only, everything else was what we already had discussed. She will maintain her residency, obviously, in Winnebago County. Otherwise,
I'll make-
everything is good. What
Yeah, I'll
we
make
had,
too many
what we
meetings,
had was
but-
sent out to the board.
Right. I believe that even the discussion of waiving the COLA for 2022 was discussed at the last board meeting.
Yes, it was in the executive
Yeah.
session.
Yeah.
Well, I move approval of the contract.
I'll
A
second.
second?
I'll second.
All in favor?
Aye.
Aye.
Okay, that's all I have. I think Dr. Williams will probably have to sign a copy of it along with Dr. Martell.
Thank you.
Okay.
And then Dr. Martell, could you just send me a copy of it once it's been signed, so I can put it in the keep it on the committee file.
Will do.
Thank you. Otherwise, I have nothing else.
Thank you, Lucy. Quality, no meeting?
No meeting, and I think that Peter has a report.
Hi, just very briefly. Our accreditation, every year we submit an annual report to the Public Health Accrediting Board, keeping them apprised of the status of the health department relative to our accreditation status. It's a two-step process. We submitted, the first step was due by December 31st, and it was submitted around the 20th or 21st of December. We just received notification earlier, about a week ago, that the first portion had been accepted by the accrediting board. That then starts a 30-day clock for us to submit part two, which provides a little bit more detail about our activities and work around staying in compliance with the standards to meet reaccreditation. That will be due on February 9th. We will be submitting that. Just wanted to also let the board know that we are up for the reaccreditation submission this year. So in the fourth quarter of this year, we will be submitting the full application to be reaccredited for another cycle through. So you'll be getting updates on that and information around accreditation. Just wanted to let you know, and I don't know if Dr. Martell had anything else she wanted to add around that. Just wanted to give you the heads up and current status of where we are right now.
Question. In terms of the reaccreditation process, how does that compare with the initial accreditation process?
I'm not sure I'm clear on your questions.
Wanted to know if it was like a duplicate of it. Is it a more abbreviated process?
No, it's a full.
Do we go through the entire process again?
Yes, it's the full process again, and the requirements change over time. So the standards that we met 5 years ago are not the standards that we'll be meeting now. So there's additional requirements, and they've redefined things, and certainly we will be reflecting the COVID responses as well as part of the process of describing it. But yes, it's a full, so annually, it's a fairly straightforward paper exercise where you really have to document some baseline information that you're staying in compliance. But now when we're up for reaccreditation, we will have to submit the full panoply of documents and descriptions, and there's a real emphasis on sort of the narrative content of what you're really doing, as compared, I think, to the first time where a lot of it was the documenting the paper, that you have the processes in place. Now they really want you to tell you what you're really doing. And so in some ways the standards are upped to be reaccredited.
Can we request that you send out a copy of a copy or a link to what was already submitted to the members of the quality committee? And then I'm thinking we need to resume some meetings of the quality committee during this year as we work forward on this.
Absolutely. Yes, thank you.
Anything else?
If we're going to go through this accreditation all over again, and it's going to be harder, maybe we ought to revisit the compensation schedule.
Hang in there for a few minutes on this.
Any new business or other matters? Do we need an executive session?
We do not.
All right.
I move we adjourn.
Second.
All in favor?
Aye.
I just want to say that I will not be here for the February meeting, but I've asked Vice Chair Lucy Hoover to fill in on my behalf. So,
Bob, could I say one thing before we leave? Most of you, well, I'm saying some of you know Inara McGrady.
Yes.
Yeah, she just passed away.
Really?
Yeah, I think it was yesterday. And I just want to let those of you that remember her, she was former president and member of the board. So just keep her family in your prayers, please.
Thank you.
Yeah,
Thank you
you're
for
welcome.
alerting us.
Thank you.
Thank you.
Thanks, Ron. All right, we've adjourned. Thank you all for coming. We'll see you next time.
Thank you.
Okay.
Thank you.
Good night, everybody.
Goodbye.
Good night.
Bye.